President Trump's leg swelling and hand bruising have sparked headlines. It was then revealed that he had chronic venous insufficiency. Can a naturally occurring dye found in berries help resolve the president's cankles? We looked at micronized flavonoids as a possible treatment. Through our research, we were surprised at what this little-known supplement can do.
Welcome to Doctors Rating Trends. This is a show where two Ivy League trained doctors dissect the latest medical trends of today and help you decide what's hype and what's help. My mission is to build the strongest case for the trend.
And mine is to stress test these claims, exposing weak study designs or overpromised outcomes.
Today we're talking about micronized flavonoids. Let's get into it. So what are flavonoids? Flavonoids are a naturally occurring substance that is in the pigments of a variety of different foods, including berries, citrus, onions, kale, parsley, tea, red wine, and dark chocolate. The word micronized means that they've been processed to create better absorption so that it can get into your system faster. There's going to be two flavonoids that we're going to be talking about today. That's Diosmin and Hesperidin. But the other flavonoids actually do have a number of positive effects. So micronized flavonoids are incredibly powerful at decreasing swelling through a variety of different mechanisms. First and foremost, this happens through a venotonic effect. The veins are the part of your circulatory system that pulls fluids from your tissues back towards your heart. And it does this by increasing the tone of those veins by increasing the amount of time that norepinephrine is stimulating those veins. It has an incredibly powerful effect at inhibiting the COMT enzyme that breaks down norepinephrine, which prolongs its activity. It also has an incredibly powerful anti-inflammatory effect. So it will actually interfere with leukocyte and neutrophil adhesion to vessels and decrease their inflammatory migration to an area of inflammation, and then also regulate the inflammatory mediators that come out of your immune system. But in addition to that, it also will reduce the VEGF expression, which is the vascular endothelial growth factor that is something that increases leakage of veins and also proliferation of vessels. And blocking that is actually a really important target of anti-cancer drugs as well. And finally, the venotonic effects actually carry over, and it has a similar effect on the lymphatic drainage system by increasing the functionality of the lymphatic vessels to pull fluids out of your interstitial area and decrease the swelling that way. And we'll see how this mechanism works across a variety of different scenarios.
I first ran across micronized flavonoids at an orthopedic conference where we were discussing post-operative swelling. It turns out there is now great data showing flavonoids can decrease post-operative swelling. A recent study just published in the orthopedic surgery literature showed that taking a supplement for 2 weeks following knee replacement surgery had a significant impact on the amount of swelling that they saw throughout the leg after the surgery. It also led to lower pain with range of motion and less nausea and vomiting. This last finding was probably due to fewer pain medications. The principle that makes this work likely can be applied to all surgeries that result in swelling afterwards, which is almost all surgeries.
There's shockingly good data showing that micronized flavonoids help with hemorrhoids. It makes sense that a compound that primarily works on your veins and inflammation would work on this disorder as well. Hemorrhoids is what happens when there's stretching, engorgement, and inflammation of the veins in your anus. Due to straining, sitting for prolonged periods, or constipation, the vessels of the anus become engorged, protrude out, and become inflamed. This causes enormous discomfort, such as itching, pain, bleeding, and some discharges out of that part of your body as well. The evidence for this is incredibly powerful. There's a Cochrane study that did a meta-analysis of over 2,300 patients and showed that there's an 88% reduction in persistent bleeding and anal discharge after taking micronized flavonoids for 10 days.
Chronic venous insufficiency hit the mainstream media recently when people noticed that Trump was getting a bad case of cankles and hand bruising. That led to this announcement.
In recent weeks, President Trump noted mild swelling in his lower legs. Bilateral lower extremity venous Doppler ultrasounds were performed, and revealed chronic venous insufficiency, a benign and common condition.
In a normal venous system, you have a constant flow of blood going back towards the heart. The way that this occurs is you have a tone in the veins, which norepinephrine helps maintain, and you also have valves in the veins that make it so that you don't get a backflow of blood. In chronic venous insufficiency, what you find is that with age, those valves start to degrade, and so you get this backflow of blood, which leads to an engorgement of the vessels. The micronized flavonoids can affect this on two different levels. One, it can maintain the tone of those veins, but it can also stop the inflammation that occurs in this process, which will lead to a flow of fluid going outside of the veins and create that edema that we saw in President Trump. There is a lot of medical literature supporting the use of micronized flavonoids for this very thing. The vascular surgeons have been studying this for years, and over the years, they've developed a lot of really good randomized controlled studies showing a decrease in the amount of inflammation or swelling in legs with chronic venous insufficiency with micronized flavonoids. Now, this isn't a standalone treatment. You have to do the other treatments that are classic for chronic venous insufficiency, which is pressure stockings and making sure you keep a good fitness level and activity level, because the muscles also help pump the blood back up into the heart.
So I have to say I was really surprised when doing the research on micronized flavonoids that we haven't heard a lot more about them. One of the most remarkable things about something with this powerful of an effect, especially, is the fact that there's almost no downside to them, because this is a substance that is found in so many different things that we eat. People's bodies are evolved to take the micronized flavonoids, and all that we could find in any of the literature was some mild GI discomfort in certain cases if people were taking them without eating. But as far as serious adverse events, I couldn't really find much of anything in the literature. So the question is, why isn't this being used more often?
What I found absolutely incredible is after I went to that conference and saw the unbelievable effects from this with postoperative swelling, I wanted to see where my patients could get it, and found that you couldn't find it in the supermarkets, you couldn't find it in the GNC or the Vita shop. You ended up having to get it online, which, given the unbelievable effects of this, was shocking to me, especially in this pro-vitamin culture we're finding ourselves in.
It's really interesting when you take a look at these studies, as well as that this isn't a part of protocols already, because these studies have been around for a little while now. And so it's kind of a strange testament of, if the healthcare system doesn't pay for something or have a CPT code for it, which is the code that doctors use to get compensated for things, then it just doesn't get, any air time anywhere. So especially now with what's happened with Donald Trump and some of these more recent studies that come out, hopefully we'll be seeing it a lot more often. And given its mechanism of action, if you really think about anything that has a very strong vasoactive effect and inflammation causing problems, this should be studied for a variety of different diseases. You actually see some very interesting studies coming out around neurodegenerative disease, people putting it into folks that have early stage Alzheimer's to see if it could actually have an impact. This makes a lot of sense that in the case of a stroke, where you actually have decreased or radically decreased perfusion to the brain from a clot, the real problem, in addition to the damage that's initially done, is actually the inflammation that happens afterwards. So it seems logical that you'd want to give this to stroke patients. And then increased vascularity is something that people really worry about in cancers. And that VEGF that's inhibited, some of the major chemo, or not chemo, but oncology drugs that are out there are VEGF inhibitors. And this shows that it can inhibit VEGF rather well. So there's a lot of studies that really need to happen with this supplement.
It's amazing, as a side note, that we've been looking for ways to decrease inflammation after joint surgery for decades. And this study just came out in 2024. As kind of a fun anecdote, I had a partner that handed this to a patient that was really struggling with edema in their leg after a total knee. And they said the effect was almost overnight. Again, purely anecdotal, but the patient started taking it within 24 hours. Most of the swelling was gone from their leg.
Just got to chalk another one of these up, an amazing supplement that just hasn't gotten traction because it doesn't fit within the compensation and regulatory structures of global, healthcare systems. But let's go to, so go ahead.
Well, I was going to say it's the vitamin paradox. And one of the really frustrating things is that we get into so many vitamins, looking at them and finding they have no effect. And here's one that has an amazing effect so far, and it's hard to find.
Well, I guess it's just chalk it up to yet another one, and somebody needs to come out with this thing. So let's move to the upsides and downsides of the micronized flavonoids. And just to do a quick summary of what it is that this incredibly powerful vasoactive natural substance can do, is it has very powerful, well-studied effect on surgical edema, hemorrhoids, chronic venous insufficiency, lymphedema associated with breast surgery, and then general edema as well. And there's also strong belief that this could potentially have powerful effects on cardiovascular disease. So coronary artery disease is something that people want to take a look at and has some preliminary data on. And the sort of moonshot things would be neurodegenerative disease, stroke, and cancer.
Going back to something I'd said earlier, the effect on swelling, the mechanisms that work for total knee surgery, which the study was done on, should work on all postoperative swelling. And I know among my colleagues in the world of surgery, postoperative swelling is something that we all care about, and it's something we're all constantly trying to treat. I don't see why this couldn't be a treatment across the board for all postoperative swelling, and not just swelling, but even when you get an injury, let's say you sprain your ankle and the ankle swells up, I don't see why you couldn't use it for that either.
This is a lot more than just helping out with your cankles when you're older.
That's right.
Let's go to the scoreboard. So this is kind of a no-brainer. 3 solid check marks for me. The common sense test, it absolutely nails through a really powerful series of mechanisms of action that have been very well vetted with a number of different studies. And with that, we have very strong randomized controlled trials that show this positive impact that is in keeping with that mechanism of action. And finally, would I do it? Absolutely. If I had any sort of issue at all with swelling, this is one of those substances that has little to no downside and only upside to try out.
It gets a check mark for me for common sense. If you were to tell me that a pigment from a berry was going to be this cure-all for inflammation, I'd say that doesn't make sense to me. But once you get into the actual mechanisms, it 100% makes sense for all forms of swelling. The evidence so far has been incredibly encouraging. The study that I quoted was a double-blinded study over 13 centers. All of these studies that we've been looking at have been really well done. So the evidence is rock solid so far. And would I do it if I had any inflammatory condition? I absolutely would take this.
So as always, if you have any further questions about micronized flavonoids, or if you've ever tried it, please drop your comments in the segment below. Remember to like, subscribe, and hit the bell so that you never miss another Doctor Debunked trend. And we'll see you next time.